Hello, I'm Rose Bunger, and I will explain about generalized anxiety disorder, one of the most common anxiety disorders. I'll be giving information about the symptoms, causes, statistics, theories, and treatments of the disorder. I hope this video will be informative and reduce any confusion that you have about generalized anxiety disorder. The diagnostic criteria for generalized anxiety disorder, as defined by the American Psychiatric Association, has 6 components. The first component is obvious: excessive anxiety and worry. This anxiety must occur more days than not for at least 6 months and must be about a number of events or activities, such as work or school. The second component is that the individual must have difficulty controlling the worry that they experience. Thirdly, for adults, the worry must be associated with at least 3 of the following symptoms, and for children, at least 1 symptom: restlessness or feeling keyed up or on edge. 2. Being easily fatigued. 3. Difficulty concentrating or mind going blank. 4. Irritability. 5. Muscle tension. And 6. Sleeping disturbance characterized by difficulty falling asleep or staying asleep, restlessness, or unsatisfying sleep. The fourth criteria for generalized anxiety disorder is that the anxiety experienced must cause clinically significant distress or impairment in school, occupational, or other important areas of functioning. Fifthly, the disturbance cannot be due to the direct psychological effects of a substance, such as drug abuse or a medication, or due to a medical condition, such as hyperthyroidism. The last criteria for GAD is that the disturbance must not be better described by another mental disorder, such as panic disorder or social anxiety disorder. To me, what separates GAD from normal worry are the following. People with GAD tend to worry about minor, everyday life events, though they also worry about serious issues. People with GAD are not able to function properly in an important aspect of life, such as work or school, due to their anxiety. Everyday worry cannot be set aside to complete tasks and is instead a constant worry. Other symptoms and characteristics of generalized anxiety disorder are: when someone has GAD, focusing attention is difficult due to the mind wandering from one worry to another. GAD may lead to behaviors such as procrastination and over-preparation. People with GAD tend to avoid anxiety-provoking thoughts and images, causing them to never deal with the things that stress them and cause them anxiety. Living with generalized anxiety disorder can be a long-term challenge. In many occasions, it occurs along with other anxiety or mood disorders. There may be times when your worries don't completely consume you, but you still feel anxious even when there's no apparent reason. For example, you may feel intense, worry about your safety or that of your loved ones, or you may have a general sense that something bad is about to happen. Here are some statistics for generalized anxiety disorder. 3.1% of the population meets the criteria for GAD during a 1-year period. 5.7% of people meet the criteria for GAD at some point during their lifetime. 2/3 of people with GAD are female, but this may be only true for developed countries. GAD is associated with an earlier and more gradual onset than other anxiety disorders. The median age of onset is 31. Generalized anxiety disorder follows a chronic course, which means it reoccurs, characterized by waxing and waning symptoms. Here are some theories about generalized anxiety disorder. Biological theory. Biological factors increase likelihood of developing GAD, as well as influence GAD. There are many biological influences: inherited tendencies to be tense, uptight, or anxious, depleted GABA levels, the CRF system, the limbic system, the environmental influence on brain circuits, and the BIS system. All of these influence anxiety disorders. Psychological theories. The Freudian theory. Anxiety is a psychic reaction to danger surrounding the reactivation of an infantile fear situation. This means the way we react to current situations stems from something frightening that occurred in our childhood. Behavioral theory. Anxiety was the product of early classical conditioning, modeling, or other forms of learning. And social theory. Stressful life events trigger our psychological and biological vulnerabilities to anxiety, such as marriage, divorce, difficulties at work, the death of a loved one, pressures to excel in school, injury, and sickness. These are all potential triggers for generalized anxiety disorder. The integrated theory. Psychologists agree that generalized anxiety disorder is not influenced by just one factor, but that it is caused by the integration of 3 types of vulnerabilities. This theory is called triple vulnerability theory. It is a combination of generalized biological vulnerabilities, the biological theory, generalized psychological vulnerabilities, such as beliefs and perceptions, and a specific psychological vulnerability, such as by learning. Together, these cause generalized anxiety disorder. For example, some people inherit a tendency to be tense, which would be the generalized biological vulnerability. Then they develop a sense early on that important life events in their lives may be uncontrollable and potentially dangerous, the generalized psychological vulnerability. Significant stress makes them apprehensive and vigilant. This sets off worry with resulting physiological changes, the specific psychological vulnerability. This leads to generalized anxiety disorder. Treatments for generalized anxiety disorder are drugs and psychological. Benzodiazepines are most often prescribed for general anxiety. The drug impairs both cognitive and motor functioning, resulting in impairment in alertness, impairment in driving, as well as can be associated with falls in older adults. Worse, they produce both psychological and physical dependence, making it hard to stop taking them. Therefore, benzodiazepines are mostly prescribed for short-term relief of anxiety associated with a temporary crisis or event. Antidepressants have a stronger usefulness in the treatment of GAD. Antidepressants such as paroxetine, also called Paxil, and venlafaxine, Effexor, are both antidepressants that are used to treat GAD. Psychological treatments have the same effectiveness as drugs in short term, but are more effective than drugs in long term. Some psychological treatments for GAD are as follows: cognitive behavioral treatments, exposure to worry process, confronting anxiety-provoking images, coping strategies, acceptance, and meditation. Thank you for watching my video on generalized anxiety disorder. Some anxiety is normal, but see your doctor if you feel like you're worrying too much and it's interfering with your work, your relationships, or other parts of your life. If you feel depressed, have trouble with drinking or drugs, or you have other mental concerns along with anxiety. If you have suicidal thoughts or behaviors. Your worries are unlikely to simply go away on their own, and they may actually get worse over time. Try to seek professional help before your anxiety becomes severe. It may be easier to treat early on. Thank you.